Всем здравствуйте, мы еще раз здороваемся, потому что мы, конечно же, уже встречались.
Good afternoon, everyone. I'm saying good afternoon once again. We just met and had a brief discussion of what we are about to talk about. My name is Katerina Gordeeva. This is Nyuta Federmesser, founder of the Vera Hospices and one of the key figures in the palliative therapy in Russia. I will spare you the enlistment of all the ranks. Here we have Konstantin Khabensky. He heads the charity foundation of Konstantin Khabensky, who help children with brain impairments and other conditions. We will talk about the technology and charity technologies. Nyuta, could you please elaborate what you meant? When you first used the term, we were not quite sure what you mean, since mercy is more of a, religious term. Well, do you remember the one Soviet movie where mercy is the name that priests use? Well, I'm not quite sure that this stands true today. Mercy could mean the attitude towards a person. It could be tough, cynical even. And if we look at current state of play in medicine and even among certain charity foundations, it's somewhat degrading and even dehumanizing. People treat other people as a diagnosis and an issue, as something they should probably get rid of as quickly as possible. And the way I see it, it's something different, and I have a rationale that undergirds my attitude and my opinion. I worked out there in the field with the people, with their relatives. Mercy can be instilled, it can be fostered in people. I often cite an easy and graphic example. Remember the time when first McDonald's restaurants appeared in Russia? People queued up to enter the restaurant. And one thing struck me and has struck many other people. First, it's the quality of restrooms. It's always clean, no odor, the soap is always there, and it's a nice place to be. And the second thing is when people handed out our orders over the counter and they smiled at us and said that smile is for free. Well, people got used to a very different attitude and level of service back then. And it struck them that smile comes for free. And smile can actually be learned. People can be learned to smile. It's not difficult. Katerina, Konstantin, well, I have a question to you. Do we approach doctors to get a smile? Is that what we expect in a hospital, Konstantin? Well, we can twist it in a bit different way. It can be reduced to nothing but smiles. It will be somebody who will ask you, how are you? How was your sleep? What kind of movies did you watch? How's life? Well, Nyuta, well, you're twisting my facts. Konstantin, well, I'm not. But it is a trick that many quote-unquote doctors use this. They often work for private institutions, and people who are desperate often approach them. And this is what they seek and this is what they get. They are underserved with actual doctors, and they just address those who give them more attention. But in 99% of the cases, there's no... Well, you get the human attitude, human-centered attitude, but nothing else. Nyuta, may I? Sure. You see, take an average Joe, an average Ivan, somebody who has to get medical aid. These people that don't know good from bad, they don't know much about technology, about the ways of treatment. I actually am a proponent of public-funded medicine, since I had a larger public-funded institution in Moscow, and I mean the Palliative Therapy Center in Moscow. But I do understand that that people distrust public medicine, and which is why they go to private clinics, because they're treated as human beings there. And when I mention mercy technology, which is the name of the topic of today's discussion, I mean things that cost little to integrate and embed into the public-funded medicine. Why would we need to do so? So that people wouldn't leave the public hospitals for the lack of smiles, for the lack of human attitude. This is perfectly compatible with a good treatment quality. People often say that he's a great doctor, but he's a shitty person. Well, I don't need to employ this kind of people, and I believe that these two qualities are actually compatible. Well, people could be different, and people could be taught how to, eat with a fork and a knife, and they could be taught how to behave around patients. Konstantin, well, let me go back a little bit and elaborate a bit on the private clinics with a more humane attitude. Well, smiles do not come for free there. They charge you for a smile like 300% more, sometimes 500% more for smiles. Well, I fully understand what these doctors feel. If I walk back a little, back in the day when we worked with the American production company, and the key thing they asked us, when you come to a stage, why won't you smile to anyone? Well, we responded, we come to work, you come to smile. Well, this was, the youth drive. We were full of energy and just wanted to do something. But this is, in fact, the difference of attitudes. And this is something that you learn to do. You come to the stage set and you smile to people. You typically teach them to do this starting from the pre-K. Nyuta, this is what we do in medical institutions today. Wherever the course of medical ethics exists, this is an exercise in formality. Katerina, ethics and patient communications. It's true. It deals with communicating and informing and raising awareness of the patients. Nyuta, well, I'm not sure how do you spell out deontology and what does the term stands for, but I think, like I said, an exercise in formality. They teach nothing at these courses. Something very basic that I quickly communicate to my employees, and this is a platitude. I tell them, look, guys, you come to the workplace and you work with people who are more vulnerable than you are. They don't know what's happening to them, and you do. Which means you are in a privileged position vis-a-vis them. So the simplest thing to do is put your phones on the silent. Just never be in a situation when it's a Soviet anthem or a dog barking or some tune playing from your cell phone as you are speaking with a patient. It's the decent courtesy, isn't it? And everybody says, oh yeah, you're right. And they put their phones to silent, and it becomes a habit. Learn to sit the way we sit today, just not be standing as a towering figure over them, and do not surround the patient's bed with a bunch of your colleagues, and you don't remember his or her name, and you say, patient X, what do you have? Well, we have the colon cancer. Well, I'm not a colon cancer. I'm a human being. I have a husband. I have kids. I have my fears. I have my passions. And it's not a difficult thing to do. Katerina, well, how do we do this? How do we teach this in this heterogeneous country of ours? Look at the wages of doctors in Moscow, St. Petersburg, Vladivostok, and elsewhere in the country. Well, they work for peanuts. They work for 15,000 rubles a month, and this is the workload that they're expected to do. And they have 13 to 15 minutes per patient. Well, if they smile, if they put their phones to silent, would it hurt? Well, they get more humane attitudes as a way of reciprocity. When we go to hospital, we go to war. We go to fight for our rights. They are us. Doctors are us, and it's a way of reciprocity. But look, Kostya, if I hold a person's hand, I'm helping him or her relax, and this is a technique, although it might be called a technology. I can just hold their hand. Konstantin. Well, you know, many people refrain from going to a hospital way too often. Nyuta. Well, some of them don't, some of them do. Konstantin. Why would I just go to a hospital for somebody to hold my hand? Nyuta. Well, you wouldn't go to a hospital because you will work some brazen hussy, and it would be a stressful time spent. People are just waiting until the very last moment, until their condition worsens up to a point of no return. It's not the way people do in Europe. Well, we have regular checkups and in many companies, but this, again, an exercise in formality. I know how we go about the medical records for our employees. We put the stamps, we rubber stamp all the necessary signatures, and this is something different to an actual checkup, to an actual hospital visit, when you understand that, well, you are impaired in some way or another. You can do something that you used to be able to do, and you don't want to face this degrading treatment. You want to be treated as a human being. You don't want to work with this kind of people. Okay, Konstantin. Okay, so you go to a hospital, and the doctor has 13 to 15 minutes to talk to you. A highly skilled professional, facing time constraints. So what do? You have your own view of treatment. You've read something in the internet. You tell that to a doctor, and they have to make their way through whatever you've piled upon him. And as a master violinist, he has a skillful composition, a melody, perform as a genius, while you, as a patient, is messing with his musical instrument. You cannot fine-tune the instrument and play at the same time. What do you suggest, Nyuta? Well, I try to teach doctors to stop patients' long speeches, but do it gently, to let them calm down, to say that I understand what you feel. You have a lot of relatives, you have a lot of fears, but I've treated this kind of conditions before. I am aware of what diagnosis means. Just trust me. Well, 1 minute elapsed. It's true, but otherwise I'll be spend the rest of the 13 minutes trying to tune my musical instrument against my will. But this is not taught in the universities, Katerina. And who should teach this? Konstantin. I'm not sure who. It's a difficult system that we are living with. Whichever way we try to tune this system, doctors are often the persons with more humane attitude. They pick up their phone outside of the working hours. They try to meet you halfway. They try to do whatever possible to let you just exhale with relief, to let out a sigh of relief. Katerina, well, it is not exactly a conducive environment for more smiles. Nyuta, well, let's just remember, let's be mindful that we are not average persons here in terms of medical treatment and knowledge of medical institutions. Well, people from the Konstantin Khabensky's foundation would definitely be addressed, but not everyone will pick up the phone when their mom is calling. Well, I'm not talking about today. 10 to 15 years ago, I was a different person, and the situation was different. Katerina, okay, so what makes our doctors different? Konstantin, you are more experienced in this regard. How our doctors are different from the Western ones in terms of patient communication? Nyuta, by the lack of knowledge how to communicate. Konstantin, lack of knowledge? Well, I beg to differ. I've been in a very different kind of situations. I think that our doctors are actually ready to spend their time with the patient. They are ready to work with them outside of their working hours. You know why? Because they don't have enough time during the working hours. You have to act quick. You have to be a quick decision maker. It has to be professional. It has to be precise. And you have to articulate a plan of treatment and comply with it. Whoever is in charge of this plan, be it the Ministry of Health or somebody else, but even greatest of the professionals are put into the rigid limits of operational environment, and they have to save their own quote-unquote life energy to stay sane. Otherwise, if they will be forced to fight the system, they'll get burned. Nyuta, they should not fight the system. Konstantin, well, it might be the wrong term. We mentioned something in our conversation. So a patient comes to a doctor. Say all of us are perfectly healthy. Many patients come to a doctor when they have health issues, when they have fever, or they have psychological issues, perhaps. And not everyone is able to find the right moment to go to a doctor. So we have to look at what's happening in practice, in real life. When students, for instance, look at how doctors work with the patients, they try to adopt the right ways of conduct around the patients. So they should lead by example. What should we do? Well, I'm kind of stuck here. Nyuta, it's true that we have to start back in the medical universities. What I meant is not that these techniques will necessarily improve quality of patient care, but they will reduce stress, they will reduce the probability of emotional burn. If a doctor or a nurse feels that this person is just not okay, mentally or physically, you have to do this, this and that, and you will help them. Katerina, is there a protocol for this? Do they exist? Nyuta, well, yes, they do. Can you cite some? I can. Just sit down, take them by the hand, and ask, how should I address you? How do you want me to call you? Not like that. Patient A or patient X, just learn how to work with people. If this person is armed, so to speak, against you, learn how to disarm this bellicose attitude. And there's another graphic example, an experience that many people have went through, a huge number of women have went through. Whenever they have a child with impairments or with some health conditions, do you know what the doctors tell to this poor woman? We do not know what's their relationship in the family. You know what she's being told by the doctors? Oh, you know what? Well, you're young enough. We should just terminate the pregnancy, and you'll have a better, healthier kid. You'll have a healthier kid. You'll have enough time for that. It takes similar amount of time to say this as it is to say, well, this is a God's gift. This would be a challenge, but this will be a daunting path that we will walk with you. We have to learn how to communicate bad news. Katerina, well, there's a proper language for us. Nyuta, well, there is a right and wrong way to do it. We have examples of good and bad practices. Take Ekaterinburg. They have an official protocol for communicating news about the diagnosis for her child in the maternity house. And the refusal rate in the area of Ekaterinburg is dramatically lower than elsewhere in the country. I mean, it's simple and it saves money for the state. Katerina, well, it actually saves money for the state, Nyuta, and it saves mental health to the doctors. They go back with a completely different attitude. They live a completely different life, as it were. How do we go about implementing such a protocol on a federal level? Well, the Federal Ministry of Health told us it's not our task. Every region is perfectly capable to do it on their own. Well, what caused the refusal?
Well, I think there is some incentive for public servants to go ahead with this, and local ministries have authority to develop these protocols themselves and implement them. But Konstantin is right. A public servant working in the area of healthcare and practical doctors, they have too much paperwork to cope with. So you need to help them. You need to set priorities to them. You need to tell them what's really important, and it's up to the leadership to do this. And I'm sure that if I start telling practical doctors that they need to smile, they need to treat people differently, they will frown upon me, saying that, well, I don't have time for this. I only have 17 minutes per patient. And if I talk to chief physicians, for example, then we will end up with adding extra people to our hospitals and clinics. In all private clinics, there are people who are responsible for interacting with patients and preparing the paperwork. We do not have these people in state-funded clinics and hospitals. And if we implement these positions, it will not substantially increase our costs, but it will help a lot. We should have people who are capable of interacting with patients, who are trained to properly handle these contacts. So that will alleviate some burden. That will take some of this burden off the doctor's shoulders, and that will help directors of hospitals and clinics to hold their doctors responsible for properly treating patients. How do you think you should manage this? I mean, how do you measure the level of friendliness of a doctor? You don't have to measure that. I mean, if you treat people in a friendly way, if you, as a director of a clinic, treat your people in a friendly way, they will automatically be more friendly with others. I mean, our system is set up in a funny way. Directors of our clinics are not working for the benefit of their reports, they are working for the benefit of their management. And public officials are also working for the benefit of their superiors and not for the benefit of the people below them. And we need to, so it's the other way around completely. Director of the clinic needs to work for the benefit of the doctors, and the same goes for all other components of the system. To me, from my perspective, directors of clinics, hospitals, and head of social centers are instrumental to sending this message across. They are the key people who are training their reports to properly interact with patients. And we have many examples, like take Yaroslavsky region, for example, Porechye village. The same people 4 years ago used to lock old ladies with dementia in a room because these old ladies in dementia were getting in their way, preventing them from taking care for other residents. But now it is the best elderly care facility in that region, and they have also received the presidential grant for this. So you see, we have good people working in these care institutions, but these good people are squashed by the burden, by the administration burden that we put on them. take this burden off their shoulders, and they will open up to this world. And all of a sudden, you will see that this attitude is possible. Well, it's very easy to say, to take this burden off their shoulders. But am I right in saying that doctors spend most of their time preparing paperwork during the contact with patients, like prepare the paperwork to put a patient into hospital? Somebody still needs to prepare this paperwork. Do we have to employ more people to do this? I'm just trying to understand. And if they have to employ more people, where will we get the budget to pay for them? Well, you need to fight for this budget, but that's not up to the frontline doctors to do this. But the starting point of our conversation was a bit different. Our doctors are put in difficult circumstances. But plus to that, we have to find some way for the doctors to relieve the patient so that the patient is no longer scared or is no longer afraid. The doctor should somehow make the patient feel like a human being, properly treated human being. That's what we are talking about, right? Yeah. And there are ways to do this. And there are good examples. Like Ekaterinburg, you said, is one of the examples. They took this approach. And implementation of the protocol to communicate diagnosis to a mother, it doesn't take a lot. Like, for example, in a cloakroom, you can put a chair, and old people can sit on this chair when they're putting these plastic shoes on. It doesn't cost you anything. It doesn't cost you time. It doesn't cost you money. But actually, we don't want to go to hospital, or we don't want to see the doctor, not because we are afraid to hear what the doctor is going to tell us. We don't want to be humiliated. We don't want pain. But pain is an important part of our life. And you need to have this feeling of pain. And many medical procedures are quite painful, like colonoscopy or other things. So you need to relieve people from this physical pain. And correct me if I'm wrong, but I don't think we have a mandatory protocol for relieving the pain of patients. Thank you for mentioning this, because there is compassion and there is mercy, and mercy is about relieving the patients from pain. We have multiple procedures which are covered by medical insurance, but anesthesia is not covered by these ordinary medical insurance. So you will have to go through a very painful medical procedure without anesthesia, and that's absurd. And in many regional hospitals, doctors say we don't have an anesthesiologist. But again, that's absurd. And if we take this approach, that means that the image of a doctor, the person wearing a white robe, will be very closely associated with excruciating pain. And also, during the first contact with the patient, the doctor would ask you many questions about your weight, about your lifestyle, and all other things. But the doctor normally does not ask a very simple question: where do you feel pain, and what kind of this pain is? And after a surgical operation, and the patient may feel pain, and well, what do you expect? It's a normal reaction of the body to a surgical operation. I remember a seminar in Austria and where doctors were discussing the issue of pain, and there was a question in the survey which was something like this. Let's say you are a football fan watching a game, and you're a doctor. You can see one of the football players is getting his leg fractured on the field. What are you going to do? You mean as a professional doctor? Now, yes, what would you do, Konstantin? No, let Nyuta finish. So it was a seminar for the doctors. So let's say you're a doctor, you're attending you're watching the football game, and you see that a football player gets his leg fractured. Well, I would not intervene because the team has its own doctor, by all means. What do you think? Don't try to be so smart, Katya. Of course, there is a doctor in the team, and so you have many doctors watching this game, and every doctor thinks exactly the same, but for some reason the team's doctor may not be available. Because the point of this question is the humane attitude. It's an attempt to push our doctors towards the idea of properly treating patients, because if you don't intervene just thinking that there are people to address the situation, then you may miss this. Okay. Probably I didn't ask the right question. But anyway, I think the right way to address the situation would be to go into the field and push away everyone who doesn't know what they are doing and do what you are supposed to do from the professional perspective. But the first thing that you actually should do, should relieve them from pain. And during that seminar, only Russian doctors, to great surprise of the organizers, said, call an ambulance, because our doctors are put in a very strict environment with a lot of restrictions. The first thing uttered by all other doctors, about those coming from Russia, was, you need to relieve the guy from pain. Take the pain shock away and then deal with the problem. Our doctors sometimes believe that a patient should not be fully relieved from pain because the relieving from pain may cover some valuable symptoms. And I just don't see how it works. And it is about compassion. It is about mercy. You first inquire where the patient feels the pain and what this pain is like. How expensive, how much more expensive do you think your approach would be? Not expensive at all. For some medical interventions, you may require an extra anesthesiologist. And normally you do have an anesthesiologist in hospitals. If it is then a local doctor may not have an anesthesiologist available for him, but all he or she needs is drugs, painkillers, and these painkillers are easily available. So you need to kill the pain first, and then you need to intervene. And all these things, they do not require a lot of time or a lot of money. They require knowledge and proper attitude, and you only develop this knowledge when you have information available to you. And this is the thing that we see on a daily basis. And I do remember your comment. It's not just about care facilities for terminally ill. And we have questions like, do we have painkillers which you administer in other ways, not just by an injection? The first reason why you shouldn't use an injection to kill the pain is because an injection is painful by itself. Our doctors have no idea that we have painkillers available here in Russia, and they come in the form of pills. They're pain-killing.
Это есть, это недорого стоит, а мы этим не пользуемся. Это тоже входит в технологию.
There are other ways to kill the pain, and not necessarily an injection. That's the point. Well, we are not doctors here. Well, at least we have not been trained as doctors. I have some sort of a medical degree, but in the organizational area. Okay. Konstantin, you are a founder of a charity foundation. Have you seen any changes in the attitude of doctors towards patients? whilst your fund has been within the time when your fund was around. Do you think we can help both doctors and patients to better understand each other? Well, I'm mostly in contact with those doctors who are very much interested in remaining very professional. And they don't need to be incentivized to display professionalism. They're not asking for more money to work better. These doctors are interested in saving people's lives. So we keep working with these doctors after we met them for the first time, after we found them for our foundation. And these doctors build teams of like-minded doctors all across Russia, actually, because we have regional conferences as well. And so we have more and more doctors. Yes, that is the point. So we have more and more doctors who are ready to treat patients properly. Yeah. You have, there is a medical ethics code, and we have the oath. They take, the doctors take the medical oath, and these doctors help people. They help people to live. Yeah, but the question is it possible to do something to improve the system? We are helping them already. We are helping them to improve. We are helping them to become better. We have quite a bulky state-owned machine, and this state-owned machine is not flexible enough. And we have this charity foundation, and we have enough flexibility, and this flexibility is complementary to what is being done by the state authorities already. And volunteers also play an important part here, I think. Important is not the right word to describe their role. They're playing the crucial part in the system. They are one of the integral components of medical operations. Ms. Federmesser is talking about reformatting this system on a grand scale and retraining doctors. And my point is that this approach is still met with resistance. So let's take some good examples like the one you have in Yekaterinburg. Let's try and find directors of hospitals and clinics who may be interested in implementing similar approach. And I guarantee we have such doctors. So let them try and implement this approach in one of the departments of their clinics, at least. Let them try and practice this. So there are people even in doctor's uniform who still believe in miracles. These people, they have performed multiple surgical operations already. They saved many lives, and they are mature people, but they still believe in miracles, and thank God they do. Because human attitude may have as much positive effect as a surgical operation. This is why we keep saying the same thing over and over again to the relatives of people with these diseases. The way you treat them, the message that you are sending them, the attitude that you display to them is extremely important. If you believe that you no longer have energy to remain positive, get recharged, walk away for a bit, do something. But that's a technique. Exactly. It's a technique on the one hand. On the other hand, it's personal interest. But you can ask your relatives to be like this. But doctor-patient contact is normally a contact between two people who don't know each other. And the doctor needs to stay with the patient and display the right attitude So I think if we are to try this approach at all, we need to start with medical schools. We need to start with students, and we need to train them, and we need to let them go into this big world, let them start working for clinics and hospitals, and let them become the standard bearers of this new ethics. But you need to prepare, I mean, you need to plant them into well-prepared soil, otherwise they will just die there. There is an organization called Perspective in St. Petersburg, and they train their people to work with people with mental disorders and mental disabilities. They trained them to act in a proper way, and they send them back into those institutions where they worked. Well, and they just left. They just left because they found it impossible to remain working in this environment.
That's not the way we go about. So we have a different working culture. So what I'm talking about is the need for the parties to meet each other halfway. We need to teach people these techniques. It could be the role games. Perhaps it's the Ministry of Education's mandate. Perhaps it is. Katerina, yes, that's the Ministry of Education's mandates, part and parcel. Nyuta, true, that's what they do in the social effort. That should be a proper training course, and not just an exercise in informality. They have to play out, role play the typical scenarios. There is a variety of courses available at the moment, and many hospitals send their staff to go through. This should be a mandatory part of this learning process. It would be a way to teach people. Konstantin, may I ask a question? Say, I'm a doctor, a professional, a consummate professional. I am keeping abreast of all the latest developments in my field, and I have a line of patients for the next half a year. But I'm a shitty person. I am a shitty person, but I'm a great professional. How do you incentivize me to go through this training? I do what I do best. How do you motivate me? Nyuta, I will not. You are a mature person, and there is no way I'll be able to change your world outlook. Do we have still more time? Yeah, 4 minutes. Well, I was afraid of facing a not quite as professional doctor. I went to Israel with my 4-year-old child. I was not quite sure about the skills, about the doctors who addressed my fears. It was a young guy, a medical worker, but not a doctor, who tried to assuage my fears, to help me calm down. We were in a special room for relatives. There was a screen with a list of patients, of surgeons, the deadlines for the surgery, and color codes. Red, yellow, and green. And he addressed everyone. He says, green light means everything is going okay. Yellow means some unpredictable impediments, but rest assured, that's a usual thing. We are trained to deal with this. In a couple of minutes' time, it will be green again. If it's red, well, it means that's a serious issue. But again, we have trained professionals on our teams, and we'll do something about it. And he kept saying this like a mantra, and it worked like a charm. It was a room full of agitated people who were fearful for the fate of their people. But imagine a surgeon after a tough surgery going out from the surgery room, and he will be surrounded by these family members, it's not the right thing to do. We'd better have such volunteers on our crews who will cost relatively little for the stuff. Katerina, you are speaking on behalf of the state, or the chief medical doctor. Nyuta, well, chief medical doctor perhaps. I don't need any particular support from the state. I just want to instill my own belief that medicine is partially a service, and smile comes for free. Smile may serve as a metaphor in this example. So we should work from different directions, should approach it from different directions. There are easy and affordable steps we can take. I mean, put a chair in the wardrobe, put a water bottle, water cooler in every room so people can have a glass of water. Put the locks, for Christ's sake, in the restroom so people can go to a restroom without fear of doors opening up suddenly. Let children under 15 visit hospitals. It is today, it's prohibited today. Konstantin, one other thing you mentioned, create proper conditions for the doctors. Well, you mentioned this volunteer, this guy who talked about the green, yellow, red color codes. He's not supposed to be a medical doctor, Nyuta. No, he's not supposed to be. He's not even supposed to be a staffer in the hospital. I mean, he probably was wearing the scrubs, but, you know, I remember his face, but I don't remember the surgeon's face, although I'm grateful to both of them. Konstantin, well, you should be remembering both faces, I guess. Katerina. So, okay, so what's the message we're trying to send to the society and to the ministries? Nyuta, we need to chart another course, to chart another path and another approach for learning. Okay, so that's the message that should be sent to the Ministry of Education, Ministry of Health. Katerina, yes, we should spread the best practices among the medical community. And the third message that we're about to send, we should perhaps design some sort of a medical protocol for giving painkillers. Nyuta, and I would top it up with two more things. We have, well, the KPI, Key Performance Indicator term. You know what? Today, all the KPIs are linked to figures that have nothing to do with actual quality of the service rendered. We should change the set of the KPIs used. How do we measure the accessibility of aid? Number of patient beds, number of doctors who visited a patient. We are not using a human-centered, a patient-centric approach, and we are not even measuring it, so it's not quantifiable yet. And it's an important thing to improve and to address. The way I see it, we need communications protocols. The ways to communicate with patients, the way to communicate the diagnosis, to help those dedicated and devoted medical professionals Konstantin was talking about. They are asking us, they're approaching us and asking, how do we improve our work? They're just asking us for the techniques. Katerina, thank you, Nyuta, thank you, Konstantin. It was, I think, the pioneering talk on this topic, and I think there will be more. Thank you.